Well, thank you, Jay, starting us out, Pete, Ann Borders, our previous CEO. I appreciate all the kind words. Again, welcome to the Cummins family. We are so happy to have you celebrate with us tonight. I'd also like to recognize our staff that are here. We invited our leadership team, some of our key members of our staff. Not all of them were able to make it, but if you're a staff member at Cummins, please stand up. Keep standing. So we have people that are very new to our organization, and then we have people that have been here a long, long time. So if you've been here less than 5 years, go ahead and have a seat. I think one person sat down, Elizabeth, our new CFO. If you've been here less than 10 years, please have a seat. Less than 15, less than 20, less than 25, less than 30, and we have Patty remaining. Patty, how long have you been? 31, 32? 35, okay, my goodness. And Dr. Mannon has been with us 26, something like that. 27. I've been with Cummins a little over 30 years. And so we do have a lot of dedicated staff, regardless if you've been here a year or 35 years, it is this team that continues the vision of this organization. I want to echo Ann's comments about Kathy. Kathy, thank you for putting together this wonderful evening tonight. We appreciate all your work and your dedication. How long have you been with us? Many years.
Just about 27.
About 27 years also. So I couldn't do it without Kathy. Kathy keeps all of us organized. So thank you very much for that. Well, you've heard a little bit of the history about our organization, with Thelma starting this organization in her home, meetings held in her home, along with Betsy from Putnam County. And as I think about the growth of this organization, it really is amazing. When Cummins started, I was reading, I think it was a paper Betsy Rector put together, and it said it started with, when the organization was actually formed, 2 staff. There was an executive director and a secretary, and they served 15 people that first year, okay? And then they said by 1975, we had grown to 18 staff, and by 1982, we had grown to 62 staff. I joined the organization in 1992, and there were about 80 staff. I found an annual report that we had put out my first year at Cummins, and I actually have it with me right here. And in this brochure, every staff member is listed here. I mean, you'll find Patty Hopkins' name in here, and you'll find my name in here. And it's just amazing that we could get every staff member on half a page. So that was 1992. And now today we have over 400, and I think I looked in 421 employees in the organization, serving close to 10,000 people a year. So the growth is really amazing. We started obviously in Hendricks and Putnam County. We are now in 5 counties. We have offices in Indianapolis. We have offices in Boone County and Lebanon, and also in Montgomery County and Crawfordsville. We're in well over 100 different school systems. And so we really are touching so many lives and making an impact on them. While our core services have remained the same over the last 50 years, many new services are now being offered at Cummins that over the last, really since I've taken over as CEO in the last 5 years. We now offer in our Hendricks County office primary care services, and that has been a goal for many, many years. When Ann was here, we talked about primary care integration, and we've co-located therapists in private doctor's offices, and we've done that over the years, but now we actually have primary care services in our Hendricks County office for those people who need a primary care physician that do not have one on their own. And that is, again, looking at whole person care to wrap our services around the services that the entire person needs, both behavioral health, physical health. We're looking at housing stability and food security and employment over the years and transportation services, all the social determinants of health, because all of those services need to be provided to those that we serve. We also, in addition to primary care services, we also have a mobile crisis team. Now, we've always provided emergency and crisis service 24/7. But what's different now is we have a mobile team that not only are we providing telephonic help, but we also go into the community. We go with law enforcement officers, we go into the schools, we go into people's homes on a 24-hour mobile basis. And so that's a new expanded service. With our medical services, we're now providing interventional psychiatric services. We have a Spravato clinic, we have a TMS clinic, and Dr. Feckerty has many, many visions of enhanced services. So there's just and that's just a few. We have a wonderful partnership with the Department of Child Services. We have wraparound services, family preservation services, just such growth. And again, it's trying to reach as many people as we can in the community. So we have come a long way over the last 50 years in the treatment of mental health and substance use work. But our work is not done. And again, as long as there is stigma, as long as there are mental health needs, Cummins needs to continue on. And we will continue to work to fulfill the vision and the mission of our founders. And I personally could not be more honored and proud to work for this organization along with the best of the best for the staff that you saw standing up, and they're all their co-workers also. So thank you for coming this evening to honor Thelma and her legacy and to honor the history of Cummins over the next 50 years. And we look forward to the next 50 plus years. Thank you very much.